And it's A Leg Up with Dr. Randall Julef from the La Bella Vita Laser and Vein Center. The podcast about how you can keep your legs healthy and strong so you can put your dancing shoes on. I'm Spud McConnell here with you and Dr. Randall Julef, so let's get right to it. And another episode of A Leg Up with Dr. Randall Julef, the man who keeps your legs looking better than if you hadn't gone and seen him. So there you go. Hey, Randy, how's it going?
Things are going good, Spud. Thanks very much.
I'm glad well for you, because I know you're in Hawaii right now, so the forest of legs over there must be pretty attractive, I'm guessing.
Yeah. Well, you know, they've got some bad-looking ones here, too.
Well, that's from eating spam, man. That's some spam-eating folks over there, I gotta tell you.
Oh, yeah, spam and rice. You know, rice is not good for you either. But, yeah, actually, you know, vein disease, it's an inherited kind of thing, as you know. And so genetics plays a huge role. And the genetics that we see in Hawaii, well, you know, I mean, it's all over the country.
True.
You know, it's a very, very common problem. But
I mean, if it's genetic,
yeah,
like we talked about before, but if it's genetic, is it still possible to get it? I mean, should you not eat a lot of spam or a lot of rice? I mean, should you be chomping down on pineapples and tomatoes instead, or is it if you're not predisposed family wise to get it, should you just not concern yourself with it?
No. Well, you can. I think what you're asking is, if you don't have the genetics, can you still get or develop venous insufficiency? And the answer to that is yes.
Okay.
You know, because there are other factors involved. For instance, you know, in women, pregnancies plays a huge role. Pregnancies is a risk factor or multiple pregnancies is a risk factor for vein disease.
So
because
like that woman, the Duggars, who had 19 kids, so her veins probably look like
her veins probably are terrible. Yes.
Yeah. Okay.
But so that plays a role. People who work in a profession where they're on their feet all day long, they have an increased risk of developing vein disease. So, you know, we see a lot of nurses, we see a lot of beauty parlor people and pharmacists and retail people. Anybody who's on their feet all day long, they have an increased risk. But probably the most important thing is genetics, and yeah, you know, if you have one parent that has had vein disease, their children have a 60% chance of developing, you know, significant venous insufficiency.
Wait, 50, not even more than 50% if one of your parents had it.
Exactly. Yeah, more than half and half. If both parents have it, then the likelihood that their children are going to have it is about 90%. So it goes way up, you know.
Well, I mean, all the doctors basically say that if you want to live to be 100 and not just eat yogurt and shit like that, then you need to pick your parents. But nobody gets to do that.
No, unfortunately, no, we don't. But what I was going to say is the Polynesian genetics that we see here in Hawaii is very, very strong for vein disease, and in addition, you know, just culturally, they're hardworking people, and many of them are in jobs that require them to work hard on their feet all day long, day after day, and that just makes the whole thing progress even more.
Was it like that all along? I mean, you know, you don't. Of course, I don't know if anybody goes there, if they've ever done studies up in there, but in like say in Central and Southern American countries that don't have as many roads and concrete as we do over here, they spend a lot of time on their feet. But I mean, they're walking on the ground, which tends to give a little bit more than concrete and asphalt. You know, so are we talking about people who are on their feet all the time who are constantly on terrazzo floors and tiles and up and down roads and stairwells and things like that, or is it just being on your feet's going to give it to you?
Yeah, I think just being on your feet, it's a little bit of an old wives' tale. The hard floor, or this, well, I worked all my life on cement. That's what you hear. That's not completely true. I think it's much more important that they've worked on their feet all their life, not necessarily that it was on tile or cement or whatever.
Mm-hmm.
Because people who work outside, they could have the same thing. So I think it's just a matter of being on your feet most of the day, as opposed to a more sedentary, job, or a desk, office kind of setting.
But that seems to be bad for you too. I mean, if you're situated all the time, seated all the time, if you're on your feet all day, your veins are going to suck. And if you're sitting down all day, your arteries are going to suck. So I mean, where's the happy medium at? Y'all got a pamphlet posted on that one?
Yeah, you know what? We need to develop that. But yeah, you're right. A few years back, I can remember there was sort of a push for, you've got to be on your feet all day long, and there were. They came out with these elevated desks,
mm-hmm.
Desks that would go up and down.
Yeah, I've seen those things, yeah.
There was a fad where people started to, even if they were in an office setting and at a desk, they spent much of the day standing up. And there was good information to indicate that was a good thing, actually. I mean, there had been studies, and they found from a statistical sort of standpoint that it did have an effect on the cardiovascular system and blood pressure, and even, metabolic things like diabetes and that kind of stuff. So, there was some evidence that actually was good. And then some people took it to an extreme where you'd set up a desk on a treadmill, and you'd actually not only be walking, or not only be standing up all day, but walking. But probably somewhere in between. Because I can remember when I saw that happening, I was thinking, oh, good, more people are going to be developing vein disease because they're on their feet all day long. Yeah. So anyway, like everything, there's a happy medium that has to be acquired.
What about if somebody? Of course, I'm thinking about a bar stool when I say stool. But what about if people were sitting at taller stools? Like, for instance, if you're on your feet all day, that I understand, because your feet are taking the entire weight of your body. They're every time you take a step, it's like pounding on them. But if you're sitting down, then your knees are bent. What would happen if there was somewhere a happy medium, like sitting on a stool, and it's very easy for you to just stand up and take the weight off your back for a little while, and then sit back down and. I mean, even me, I'm in front of a computer most of the day, but about every 15, 20 minutes, I got to get up and just, if I don't do anything more than walk around the room, I got to do that, because it's going to get to me.
Yeah, well, that's it. That's what people need to do. If you're at a desk job, then, getting up and walking around for a little while, the standing in the worst thing to do is to stand in one place and not walk around. That's the worst thing that you can do all day long as far as your leg vein health goes. Mm-hmm. Now, next to that is sitting down, with your feet on the floor, and just staying in that position all day long. That's not all that good for your veins either. Because at least the lower part of your legs are still in a completely dependent position, going downward.
Yeah.
So probably, again, I think just what you described, probably the best of both worlds is to, if you're at a desk job, then, every hour, every couple hours, get up and, you walk around the office or whatever for 5 minutes, just find something to do where you're up and around walking. And that's probably the best balance, as opposed to those people who do work on their, work in a retail situation or a situation where they're on their feet all day long. If they can incorporate sitting down and maybe elevating their legs a little bit, periodically throughout the day, that would bring about a good balance.
Yeah, I remember, and I want to hit you up on that later about that kind of thing, because we did talk about elevating your legs with the venous insufficiency, because basically what it is it's not your veins are not pushing the blood up. Your heart pushes the blood from your heart out through the arteries and capillaries and everything else. But the heart has nothing to do with pushing the blood back up through the veins. That you have to like physically move around. So if you're stuck sitting at a chair all day, you're physically not moving around. And if you're standing in one place, so basically it's just, sedentary, either on your feet or on your ass. Doc, I guess that's the killer.
That's what it boils down to, yes.
Oh, man, that's my favorite thing. I'm real good at sedentary, man. I'm good at that.
Yeah. And you put your finger on the key there, Spud, and that is that you have to use your muscles. When you contract your muscles, that helps blood flow through veins. And that's essentially what you're doing when you're getting up and walking around the office or walking around at home or whatever, is you're getting those leg muscles to work. Well, some people have, and there are products out there where you can, if you're sitting at a desk all day long, you can, they've got these little devices that you pump with your feet, or you move your legs up and down or whatever. That would be beneficial too. If you were going to really consistently do that throughout the day, if you're at a desk. When you get on a plane, and they do this, more for blood clot prevention. But if you look at the in-flight magazine, on every plane these days, you go to the back, and they tell you, the several things that you should do to, prevent blood clot while you're traveling, long distance on a plane. And one of those things is to exercise your legs in some way, with even with you sitting in the seat, mm-hmm. Flexing your foot up and down, and extending your leg, and et cetera. So that muscular contraction is the key to getting blood to move through veins.
That's that. I've seen that ad. It's on the back of the magazines. It's right next to the X-ray glasses. So
right,
you can look at that. Let me look at my legs. Oh my God, I need to flex my feet. Okay, let's get back to the genetics of this whole thing. I mean, if now of course, medicine has advanced, but they've known about this particular thing, venous insufficiency, for how long, you think? 30 years, 50 years, 60, 100 years? How long have they known about this?
Well, I got to tell you, a long time. If you can go back to early Greek and
really?
Egyptian writings, and there's something called the papyrus. There were several different types or forms of medical related writings from ancient times, and even in those ancient writings, there are references to problems related to the legs that were very likely due to venous insufficiency. There are ancient writings from ancient Rome, and they described wrapping legs, with whatever type of cloth they had or whatever, it seemed like they were wrapping the legs to help with the soldiers and their activities. They weren't really wrapping the legs for protection, because they had other protection, but for whatever reason, in whatever way, they stumbled upon the fact that if they wrapped the legs, the soldiers' legs worked better, over a long period of time.
Is that kind of like in the World War I and the doughboys, those outfits, especially the Marines, but the Army too? The Navy had puttees up the legs, but I mean, they would put on their boots and everything else, and they would have this bandage-like thing wrapped all the way up to their knees. It was kind of like a part of the uniform. I mean,
may very well have played that role for sure. But Hippocrates, everybody's heard that name before. Mm-hmm. And he lived, I believe it was the late 1400s, but Hippocrates actually connected venous disease or venous insufficiency with ulcers that formed on the lower part of the leg. So he was the first one to kind of make that connection, and he also described wrapping or putting some sort of appliance to the leg that essentially acted as a compression stocking. Nowadays we have compression stockings, and that compression to the leg is beneficial for vein function. Hippocrates connected venous insufficiency, also venous ulceration, and wrapping of the leg to try to treat that. So that was a long time ago. Yeah, right. The concept of venous insufficiency and vein disease, it's been around for a long, long time. Now, back then they were still kind of figuring out the entire circulation.
Well, yeah, they would bleed you too if you got like VD or something like that. So.
Yeah. So the concepts have been around for a long, long time, and we've been treating it surgically for a long time. Also,
not that long, though.
Well, not. Well, let me see. Probably when they eventually developed general anesthesia. Back before there was general anesthesia, there was surgery, but I mean, it was only if you absolutely needed it.
Yeah.
I mean, during the Civil War, they were doing amputations with no anesthesia.
Yeah. And I remember reading stories too about if somebody in the Civil War would get shot, the first thing they do is start pulling their clothes off or ripping their uniforms to see where they had gotten shot, because the trauma of the bullet hitting them kind of threw pain all over their body, and they weren't exactly sure where the bullet hit. So if they started looking to see if it was in their abdomen or in the upper leg or whatever, and then they started worrying about whether or not they were going to get amputated. And if you got hit in the abdomen, it wasn't the end of the world, but you were going to have to get pretty drunk for to hold still long enough for them to go and dig the bullet out.
Yeah, right. Yeah. So, probably since venous interventional kind of things, other than just compression, that it's been a fairly elective kind of disease process. I mean, people have lived many prior to the modern day vein treatment, people lived many, many years, even though they had terrible varicose veins and swelling and all that sort of thing. But so probably, 40s and the 50s is when we started to surgically address vein disease, which was basically with, just surgical vein stripping. We over the past 30 years or so, 20 to 30, we've really come a long, long way with all of the advanced kind of technology that we have in the different devices. And, it really has moved from a surgical operation that we did in the operating room with a general anesthetic and the patient was in the hospital 2 or 3 days to literally doing everything that we do as an outpatient. Everything is very minimally invasive.
Well, and that's because of the ultrasound, right? I mean, before if somebody had bad veins, you had to actually cut their legs open and get to it. But now, since you can see what you're doing with the ultrasound, you can do everything with the little tiny slits and go very specifically, and that's the minimally invasive stuff because you got the better tools for it.
Yeah, right. Visualization. For diagnosis, but we use the ultrasound for diagnosis to figure out if somebody does have venous insufficiency or not, and then we use it also extensively during the procedures that we do. And yeah, you're right. The ultrasound machine has allowed us to, in real time, be able to see blood vessels and enter those blood vessels with a small needle, and we use wires and catheters and stuff. So. Not only the devices that have been developed over the last 20 years, but also, yes, ultrasound has been tremendously important in getting us to where we are today with the whole field, for sure.
Now, what should people, so it's mostly genetic, but you can still get it if it's not genetic. But what should people be looking for with venous insufficiency? You know, is it automatic with old age, and where does old age begin? Can you tell if somebody's got venous insufficiency as early as somebody in their 20s, or, you know, something like that? What should people be looking for, since I made the ugly leg joke?
That's one of the problems with venous insufficiency is that it's not always obvious to the person, and you know, do young people develop venous insufficiency, and does it get to a very significant level? Yes, absolutely. I mean, it kind of it's an equal opportunity effector. You know, we see all age groups. I think the youngest patient that we've ever had was 16. Whoa. And that was a young male, actually. You know,
was he genetically predisposed? I mean,
he had a very strong family history. And I think that was primarily it. But he was, you know, as a young kid, he was in high school and he was developing bad varicose veins. And, you know, he was starting to get teased by the other kids. And, you know, so he came in. Yeah, he had bad venous insufficiency, and we fixed it. But, and, you know, we treat people of all ages. I think, you know, we actually just recently, I treated our most elderly patient. He was 95. You know, it affects everybody.
And the fact of the matter is, though, because you can do this minimally invasive stuff, it doesn't matter how old you are. I mean, somebody might go, guy, 95, you might be afraid to come in, but it's not. Right. This is not. I mean, it's nothing to be laughed at. It's nothing to be laughed off. Well, I'm going to laugh at everything because I have no class. But just because you're over 90 doesn't mean that you're not. This is a very survivable operation that you do. It's very, very simple. You can do it in your office, and this is nothing to be afraid of.
Right, and we get that question all the time. You know, people come in and being evaluated for their vein problems, and you know, they'll say something like, gee, you know, my mother, she has bad veins, and, you know, she thinks she's too old, and I say no, and she's 80 or whatever, and I say no, absolutely not. You know, have them come in and we can evaluate and figure out what they might need, and you know, most of the time we're able to treat those people for sure. And if we can't do the procedures, we can always treat them, you know, conservatively, and try to help the situation. But you know, with respect to people asking themselves, gee, do I have vein disease? You know, it kind of starts with is there a family history of vein disease, you know, in that person's, you know, genetics? But often they don't. It might be, but they don't know about it. You know, maybe it was in a grandparent or in an uncle or an aunt, and they didn't know those people very well or whatever. But you know, varicose veins are kind of an easy thing for people to figure out that they have vein disease. I mean, you know, if they've got a bunch of big bulgy veins on their legs,
You're more likely to have it with varicose veins or spider veins, or I mean, I'm sure varicose
either
veins, but spider veins is a good indicator that you should get checked out.
You know, people come in all the time, and primarily all they have is spider veins, but they may have other symptoms, so they get evaluated. Virtually everybody with varicose veins have that underlying venous insufficiency. And yeah, you know, when we say venous insufficiency, we mean poor function of the veins that are deeper in the leg, you know, the veins that you don't see superficially, you know, spider veins and varicose veins you do. So if they have varicose veins, inevitably they have venous insufficiency in one way or another. With spider veins, I would say it's more like, 50 to 60% of people with spider veins have venous insufficiency, but there's a little higher, amount of people who just have, sporadic spider veins. Yeah. But it's, there's so many other symptoms of venous insufficiency that people don't necessarily connect with a vein problem, in their mind. and they may not have anything superficially. They may not have one spider vein or one varicose vein. But, in the symptoms, the common symptoms are achiness, heaviness, and fatigue. Those are three of the probably most common symptoms.
Yeah, but those are symptoms of a lot of things. I mean,
but they can be symptoms of other things, but they're fairly specific for venous insufficiency. So, if your legs get achy by the end of the day, if you have a little bit of swelling is another one of those symptoms that people don't necessarily connect with, gee, I have a vein problem.
True, but also if people are sitting in a static situation, like the people sitting at their desks all day, or the people who are on their feet all day will just go, oh, well, my feet are swollen because I've been on my feet all day, or my feet are swollen because I sit on my ass all day. I mean, so if they just go home and put their feet up and they feel better, that's not gonna make them think about you. And
no, it's not.
That's the whole point of these podcasts, is for people to realize that there's an underlying issue that they either need to figure out it's not the case, or they need to figure out how you can fix it. And we're going to talk about that next time on A Leg Up. My partner here, Dr. Randall Julieff, who is an expert, who's got offices all over the place. He's in Hawaii right now. How many offices you got over there in Hawaii there, Doc?
We have 5 offices in Hawaii, on all of the 4 main islands, and then we have 2 on the Big Island. So the second one.
Everybody knows that you're the one, because you call it the Big Island. Everybody else just goes Hawaii, and that's it, So.
Yeah, sure. Yeah.
And then you got one in Mandeville, and you got a office in Metairie, and then you got something going on in Florida.
I have a loose connection with another vein clinic in Florida, in Destin. So
coast to coast, and then the most. So there you go. Dr. Randall Julieff is La Bella Vita Vein and Laser Center. It's labellavitavein.com for you to find out more. But look, do yourself a favor and go on there and have a look-see at some of the symptoms and such, which we'll talk about more about those symptoms in a couple of weeks when we come back. But in the meantime, you may be wondering, gee, where does all this come from? Why do my feet swell? Why am I in pain like that? And it could very well be this, and it's easy to diagnose, and 99% of the time it's a very easy fix right there in the office. Dr. Julieff, thanks for taking the time, man.
Thank you, Spud.
All right. Next time, more information about your legs here on A Leg Up. Thanks for joining us here. Make sure you tune in next time for more information about how you can keep your legs happy and healthy here on A Leg Up with Dr. Randall Julieff from La Bella Vita Laser and Vein Center. See you next time.